I'll go
Well,
pick up
no,
your card.
hey, we're live. Hey, welcome to another edition of Ancil Lea Live. And hey, first I want to say, hey, thanks for all the support and as we get closer to launching our next Common Grounds book, Common Grounds 3, I hope to have it out here in February because we're finishing up right now with just some final touches. But I'm excited about this. This book really is going to be about more about being a light in this world, and as I've talked about, and it's kind of a common thread throughout. It'll be more stories about that, and maybe faith, and um, but I couldn't think any way to say it. But at any rate, stay tuned. That's coming. But talking about being a light, I'm excited to have on today my longtime friend,
Don't tell them how
Kevin Briggs.
long.
I was counting on my fingers and toes today about how long we've been working together. Wow, ever
We
since
both
I
we
got in
both
this.
didn't have white hair.
No, we did not. And we have been a couple places together and been in health tech, working in health medical software. And of course, you've done big things. I just stay in this sphere. But man, great to have you on today, Kev.
Well, thanks for having me. I really appreciate it.
You bet. Well,
Yeah,
I'm excited. Go
both
ahead.
of us didn't have white hair. You had white hair the whole time, but
I don't think so. Man, I tell you, the thing about white hair is once it starts, it multiplies like crazy. So,
well, it's unfair that I feel the pressure of being 39 years old and white headed, but you live with it.
yeah, I'm with you. And um, so, since we've been doing this so long, hey, tell give us a little bit of your background and what you've and what your careers looks like.
Sure. So, pretty much out of college, which is deep in the last century, I've been in healthcare IT of one stripe or another. I actually helped. I worked at a doctor's office all through college, on and off, and that led me to my first health IT job, working in uh, selling selling and supporting and doing consulting work for medical record and physician practice management systems. Spent time a long time with companies like IBM and a lot of other services companies in all different sectors of healthcare IT. Uh, so, a lot of exposure to pharmaceutical, a lot of exposure to medical devices, a lot of exposure to payers, but more than any other, my career has largely been helping hospitals and health systems and providers.
Gotcha. Well, I know that to be true, and again, we worked together all along the way, and I thought it was really cool that that we shared an IBM connection. We share Millbrook. We
Yeah.
share Greenway, Mises. It's kind of runs and but that's man. We've just kind of and some of that is because you drug me along with you. So I don't know whether to thank you or blame you. I don't,
Well,
but
as long as there are no kidnapping charges, I'm okay with it.
well, hey, we were talking the other day, and again, us both being in this, um, you know, in this healthcare, health tech, health IT world, and but something really cool, something that really means a lot to me is when you do something outside that's really has an impact on others that are that you just really can be a light. And So how in the world did you get started doing this in the name of your I guess ministry is Texas Day Peru
Yes.
and tell one, how did you start that? How did you get involved in that, and what is it?
So the short version of it is, we're trying to help as many people out by doing surgical as we can by doing surgical missions in Peru, leading teams of surgeons down for individual surgical missions to help the poor, and have a lot of fun doing it. And we've been doing it about 13 years now, every year with the exception of the COVID years. But how I got started in it is kind of an interesting story. I think it is. It was both. It was marrying both worlds, my professional career and my personal life. I've had a relationship going back 3 decades with a clinic down there, and I was literally having lunch with a client who was talking about how their physicians did medical missions in Africa. And I thought, well, wait a second. I'm in healthcare and I know a clinic, and I bet I could. I can't deliver care. I'm not clinical myself, but I know a lot of people. I wonder if we could do something. And I like to think that spark to come up with that thought
Right.
is not mine.
Yeah.
In fact, I don't know if you remember the tornado that happened in Joplin, Missouri.
Yeah. Yeah.
It was horrific. So, more than 150 people were killed there,
Right.
and I got to volunteer for just a handful of days with a youth group from our church, and I had no skill or qualification to do anything up there. They had told us we're going to do some grief counseling, and we didn't do any grief counseling. And if we did, it was basically be there, be a shoulder to lean on, put your arm around somebody, and listen to them. But what we ended up doing more than anything else was picking up trash and putting tarps on houses. It was hot. It was miserable work, but it was great. And one thing that I noticed, this is long after FEMA had come and gone.
Right.
And I hope we see this happen in Los Angeles, when the fires do finally get put out. What you're going to see happen is FEMA will come in and they'll come in and they'll bulldoze the stuff that they need to. But over and over and over, hundreds and thousands of people were coming into Joplin with a back seat full of blankets or a back seat full of water or a back seat full of canned goods, and just doing what they could for a day, helping out, picking up trash for an afternoon and going home. And that happened over and over and over and over again. And my point is none of them are qualified. None of them are trained. None of us are qualified and trained. So
Right.
I think we should leave the, oh, I'm not qualified, or I'm not trained, or I'm not fit or capable or educated enough. Leave that garbage beside the road, and just go ahead and do. If you feel led to do something, do it anyway. The pieces will come together, and it certainly did for our organization. When we started, there were 4 people that I knew when we started the organization, and over the years we've had close to 300 volunteers in Peru and here in the States. And you don't know any of them to start, but you get to know them, and some of them have been lifelong friends. So if I had any advice for somebody, if you ever felt like, God is calling, or if you feel like something's happening to make you want to do something, don't overthink it. Just go do it, and it'll all work out.
Yeah, that is great advice. And so now tell me, what exactly are you guys doing in Peru, and where are you doing that?
So we take teams of surgical specialists down, and each mission week is about 10 days. And we work at a clinic, and you can see a little bit of a picture of one of the ORs in the background. So the clinic we work with, the Kasiawasi Clinic, they see about 35,000 patients for primary care throughout the year. And their mission is to treat the poor. And then teams like mine come in to to be like a cherry on top, if you will, to provide surgical specialty care for patients that need it. So as an example, that the teams that I've been leading have been either orthopedics or gynecology, and the clinic can support ear, nose, and throat, urology. There's rudimentary surgical equipment. It's a clean space. It's not dirt floor medicine by any stretch, but it's the support of the clinic is fundamental. You really can't just show up with a surgical tray and start doing procedures. You need to have that foundation, and that they provide that. But we'll literally take our patients, our teams down, leave the States on a Friday evening and get it to the clinic the next day around lunchtime, unload all of our equipment and supplies, which have been donated by folks like Baylor here in North Texas, or Methodist Health System, and then learn to breathe again, because it's very high altitude. And then we start doing our first surgery Sunday, and then do surgery Sunday, Monday, Tuesday, Wednesday, Thursday, and take a break, go to Machu Picchu, and then come home. And we typically see about 250 to 300 patients for our consults, and then do surgeries for about 25 to 35 patients during that week.
Wow. That and I'm sure you guys have seen some life-changing surgeries and treatment down there. And you say, I'm not sure what the demographic looks like on income in Peru, but you're saying that you're treating the poor.
Yeah, Peru is a developing country, and they're developing a good tourism trade, and they're developing a good mining economy as well.
Right.
When the Chinese economy has hit the skids, that's hurt Peru, because that's where a lot of their exports of minerals go to. But it's a developing country, and many of the patients that we see are subsistence farmers who may or may not be a part of the tourism economy that's growing. A lot of them don't speak Spanish or English; they'll speak Quechua, so that kind of isolates them from that economy. So farming is about the only thing they get to do.
Right.
The poverty level. It's not starvation. There's not famine going on, but if somebody's making $10,000 American dollars per year, that's pretty good. And most of them make a good bit less than that.
Yeah.
Most people wear all of their changes of clothes on their backs, wear layers, and they live in simple houses that are made very often of adobe. But there's, despite it being a developing country, and despite it being a tourist destination, there's an awful lot of poor people that need an awful lot of help.
Yep. So you're looking for surgeons right now. You're looking for folks to come in and do surgery. I know you probably have a core group of folks that probably do it every year, and I know you've talked about you've expanded it into residency programs, maybe.
Pre-med clinical job shadowing. I'll talk about that in just a second. But from a doctor standpoint, I'm looking really heavily now for orthopedic surgeons, ENTs, urologists, and gynecologists. If you happen to know of a surgical specialist that might be interested in doing something like this, I'd love to talk to them, and love to build a team up around them. So we're trying to expand what we're doing to, frankly, as many missions as we can do per year. And so if anybody in the audience know of a surgical specialist, doesn't necessarily have to be one of those. And even if it's not a specialist, if it's primary care, we can make use of those folks. In fact, last year we had a pulmonologist who didn't do any surgeries attend with us, and really no connection to the women's health clinic that we did, but he was extremely busy over on the other side, on the clinic side of the building. And that's a model that really, really works well. We like to be a program where I mean, the fact is there are all kinds of kind and caring physicians that want to do something like this, but to make the commitment in time and effort to go someplace that's a faraway place, to organize it, to build a relationship with a clinic, to build relationships with the government, to facilitate, to get the supply chain set up properly, to get the meds. By the time you do all that, and never mind the travel logistics, it's hard for people to do. And that is a value add I think that we do. We try to make it as easy as possible for doctors and nurses that want to do something like this to plug into what we're doing and just give up a week of vacation to do it. And
Yeah.
we try to set the table for them as best we can. So, like you said a second ago, I'm trying to expand. So if you know some surgical specialists, love to help build a team up around them. That would be wonderful.
And what's the best way for them to find out more and to contact you to have a conversation?
Sure. For that, go to our website, which is www.texasdayperu.org. Just like, there you go. And there's a page on there that will go directly to my schedule, and folks can set up a time to have a conversation, and we can go in great detail on what it's all about, what we need, what we expect, and whatnot.
And
You alluded to it just a second ago, the clinical job shadowing program. We've always had pre-med students make the trips with us, but obviously they can't do patient care. That
right.
they're not licensed to do that. That's not good. So in terms of that, we've classified them as non-clinical volunteers, and they're great to have. But last year, or a couple of years ago, was having some conversations with some local professors here in Dallas. And they said, we've got pre-med students trying to get into medical school. They've got great MCAT scores, and they've got great grade point averages, but they don't have clinical job shadowing hours. Med schools nowadays, they want those three things. They want to know that these students are serious, that they're making the investment to know what being a doctor is all about, and that they have seen clinicians in action so they know what they're getting into. The last thing they want to do is give up a valuable med school slot to somebody who's not serious about it, who doesn't know what to expect. They don't want to have somebody come in and say, "Ooh, medicine's not for me. I'm not going to do it." That's not good for anybody. So we formalized our program and have opened it up to pre-med students that want to get clinical job shadowing hours. They're able to get about 60 hours in that week. We work, dawn to dusk every day.
Right.
So it's a pretty rich in terms of the intensity of the experience. It's no spring break, but there's a lot of value that they get from it, and a lot of value that we get from it. The doctors love doing it. They feel like they're making better doctors. I think we're making better doctors. I can't prove it, but I think we probably are.
So again, your next you'll start doing this again this summer.
Yeah, from a clinical job shadowing standpoint, we've got one team open the week of July 11th, I think. And then we have shoulder teams that are full at this point, but we're trying to see if we can't open them up a little bit more.
Cool.
The demand has been pretty good. There's a lot of interest in doing this. And like I said, the more teams we can create, the more we can do for pre-med students as well. And by the way, for a whole lot more patients. I think this is really going to help with our throughput, which could really increase our patient volumes that we're able to handle. And good and bad, there is just no shortage of patients that need help like this. So the more we can do, the more we can accomplish.
Well, I'm a big fan, and I love this serving others, and and how that really does bless them and then comes back to bless you.
I feel the same way. I, I won't lie to you. It's I get more out of it than I think sometimes our patients do.
Yeah.
I think it's a wonderful experience. There's very few times in life where you basically are doing exactly what you're supposed to be doing, and this is one of those times. So
Yeah. Well, that's awesome. And so, hey, listen, anything we can do to help, let's put the website back up there. If you want to get in touch with Kevin, and or you can contact him here on LinkedIn directly, which is Kevin Briggs. And or if you can't find him, find me, and I'll connect you. Hey, Kevin, as we sign off here, any last thoughts?
just thank you for having me, and thank you for helping spread the word. And seriously, if anybody's interested in helping or learning more about it, or learning what my experience was like helping put something together like this, one of the things that I like seeing happen is people that have volunteered with us go to do their own charity work of some sort, or they find their own callings. And
Yep.
I'm happy to have that discussion anytime.
Yep. Nope. Well, hey, thank you for being that light, and
It's kind of you to say.
and being a blessing to others, and however we can help. So good to see you, brother. And as always, and keep the hair. I think we've got the gray hair guys going. Keep it going. And,
well, it looks good on you. Makes you look smart.
Man, I need all the help I can get.
I need a lot of help myself.
Perception is reality. Okay, so I'm that's what I'm saying. So look smart. I mean, there you go. But hey, great to see you, Kevin. Thanks for the work you're doing, and however we can help. And hey, folks, thank you for joining us today. Hope you have a great rest of the week. And if you've got any questions, please reach out to me. Glad to help. And Kev, talk to you soon, brother.
Thanks so much.
You bet.